Hello and welcome to the Society with Fatma Shaheen at PTV World. Today on our show we'll be talking about a very pressing issue, which is that of the pressing need for medical reform and of course improving community health as it does exist in Pakistan. In this regard, it's very important then to mention at the outset that we have seen that in the recent years statistics show that there has been a steady increase in chronic diseases such as diabetes, in heart disease and even in mental health disorders, which of course adds to the disease burden of the country. This in turn, as we all understand, also impacts the provision of healthcare services. How particularly does it do so? This is something upon which we'll be shedding light. Overall, we'll be talking about both the challenges as well as the solutions which Pakistan's healthcare system is of course faced with. In this regard, we'll also be talking about ensuring that everybody in the country not only gets affordable but also equitable access to the healthcare system, more particularly when it comes to the vulnerable segments of the Pakistani society, be it women, be it the elderly persons, be it for that matter the trans community or people with different abilities. In this regard, it's very important then to also mention the fact that whereas of course we do all at a very basic level aspire to improve the provision of such healthcare services, what is equally important is that we do have the requisite healthcare policies to that effect too. This and much more to follow on today's show, that too with a very diverse panel. Let me introduce you to my today's panel. My first panelist for the show today is Dr. Ehsan Alam Saab, who's a trauma specialist and an orthopedic surgeon. Assalamu alaikum ji and welcome to the show.
Walaikum assalam. Thank you.
Alongside him, I have Dr. Afzal Bajwa Saab, who is a public policy expert and he's also a plastic surgeon. Assalamu alaikum sir and welcome to the show.
Thank you very much, Fatma.
You're most welcome, sir. And my third panelist for the show today is Dr. Varda Saeed, who's a consultant gynecologist. Assalamu alaikum ji and welcome to the show.
Thank you so much for the invite.
Sir, to start the conversation with you, my first question to you would be then we see that with regards to the various orthopedic problems that people do come across, arthritis, neck pain and lower back pain have reported to be the most common ones. So as an distinguished orthopedic specialist in your own right, how adequately do you feel does Pakistan's healthcare system address all these issues?
Now, Pakistan health system has a lot of deficiencies and we will discuss in this program today. When I moved to Pakistan recently, I came across that it's just not a lack of funds or lack of resources, but to some extent it's a lack of awareness and different priorities for the patients.
Right.
And patients do have some lack of distrust with the health system. Sometimes they don't understand, they don't like to listen whatever is told to them, and they would rather like to listen to someone who they
a layperson instead.
A layperson on the street.
Or something that they come across on the media. Sir, but to what extent then are long waiting times, do they in themselves cause a hindrance for anybody to actually seek timely interventions?
Actually, what happens is that when a proper adequate care is not provided on time, patients always would go for some alternate method of treatment.
Right, sir.
So there are a number of choices available, so they will always try to do option A, B, C rather than going for actual treatment. So in my field, it's usually the surgical treatment. So they will actually try to minimize, they will try to take every step to avoid a surgical operation.
Right, which is directly in contrast, sir, to the work that you do, which I'll come to you, Dr. Saab. When we do talk about people's access to the healthcare system, here we understand the fact surgery, more particularly cosmetic surgery and plastic surgery, even reconstructive surgery in some cases, turns out to be very expensive. So is that kind of a turn off for people so as to seek requisite interventions in a timely manner?
Oh, well, Fatma, you're absolutely right. The expense of the plastic surgery when we talk of is considered to be high. But when I seek and when I basically go into the people and I see their knowledge regarding plastic surgery, it's not always aesthetic and cosmetic.
Right, sir.
We have many different aspects to deal in plastic surgery, like starting from vertex to from head to toe. If I talk of all the trauma is helped in by, it's not only with the orthopedic surgeon, we are equally stance holders, we go with reconstruction, we go with coverage, and it may sometimes require many operations.
And these are also very necessary operations
it's perfectly because it's not just in one surgery, maybe requiring 3, 4, 5 surgeries to get normal.
Right.
Once Harold Gillies is one of the forefathers of plastic surgery, he said If it is not normal, it's not enough. So we have to come to near normal. For that, basically, it's a long journey. All the congenital defects which the child is born is dealt by us as a plastic surgeon.
Right, sir.
All the skin cancers, their removal, excision, their reconstruction is done by us as a plastic surgeon. Trauma, then burn.
Right.
So basically, it's not always just simple cost. It's like a small operation having a smaller cost,
Right.
and smaller operation like 3-4 times,
Right.
maybe having cumulative cost, which is of course
Right.
more than.
Right, sir, your point is noted, on which I'll come to you, Dr. Varda. And here, of course, we must also talk about the need to consider this entire issue from a gender lens. Now, we understand the fact that a lot of times a woman's access to the healthcare system is hindered for reasons more than one, be it because of socio-cultural norms, be it because of economic factors. So, as a gynecologist yourself, what are the areas you feel that we need to work upon so as to facilitate this access rather than to hinder it?
First of all, Fatma, I'm really glad that you have come up with this question, and with this opportunity, I would like to speak about reproductive health, which is currently one of the major concerns in Pakistan. Globally, we are currently tackling with population explosion, and in Pakistan, our country being the 5th most populous country in the world, with the annual growth rate of 2.4%. So it's important to highlight the importance of family planning services and
Very
reproductive
right.
health. So for the reforms, I think first of all, the most important key area would be education and awareness. I'm going to repeat the awareness word a lot, because awareness is what we need right now. Education in the form of female anatomy, reproductive services available, family planning services available as in the community health. These are important to be delivered to the patient.
With regards to technology advancing, with regards to there being so much exposure on social media, this perhaps might not be the case with regards to women who live in urban cities. But in this regard, do you not feel then that when we do talk about the pandemic like the COVID-19 one, Pakistan was recently hit by the flood. That in itself also added to the disease burden, and that in itself also further marginalized the already vulnerable segments of the Pakistani society, which of course included women at the forefront.
Exactly, Fatma, you are right, and we should really work on the key areas like affordability issue. One of the major concerns and the barrier towards good women health is cost. So if we can cover that cost under some kind of insurance coverage, that would be a better idea, especially in the rural areas, the marginalized communities, the underserved people, especially in those areas. There is a lot of factors involving the affordability, easier access to the reproductive health, women health services, and also the over-the-counter availability of some reproductive health products and also the medications. So it's important to address all these issues and also address the taboos that are associated with this topic.
Right, for which you rightly so mentioned awareness and education is the key.
Yes.
On which, sir, I'll come to you. Here we must also talk about the need to actually cater to all segments of the Pakistani society, and Dr. Varda has very rightly so mentioned those basically stratas of the society which might be vulnerable, which might belong to a certain socio-economic class. Here, I'm sure as an orthopedic surgeon yourself, you come across so many people who you get to treat, and you've also had that benefit of working in the UK as well as in the Ireland. When you make contrast, basically, how do you compare and contrast an average person's access to the healthcare system to what it is here in Pakistan as opposed to the West?
Actually, there are so many differences. Firstly, there are segments of community who are underprivileged. They exist in the rest of the world too. So those segments, they don't have access to funds, education, even food.
Right.
So they are more vulnerable to diseases. Even their life expectancy is different. So that's the one key element.
So malnutrition is extremely common in this strata of the society.
Yeah, these are very simple things. In Pakistan, they unfortunately have less resources, and they don't access as compared to the tertiary hospitals. Those underprivileged communities, they do exist in other countries too. So it's that group which does not have proper access to health services, education, even funding or even food. So these are the people who are more vulnerable to diseases, and they can suffer because of minor ailments like nutrition. And when we compare their access when we compare Pakistan's access to health services there needs a lot of work to be done actually.
Right. So on which I'll come to you, Afzal Saab. Here we must also of course talk about the need to facilitate different segments of the Pakistani society's access to the healthcare system. And in this regard, I'm particularly talking about surgical interventions. Now, as a plastic surgeon, we understand the fact that you must be coming across people who belong to different stratas of the Pakistani society, be it differently abled persons, be it transgenders, or even women who unfortunately are victims of asset violence. So when it comes to these segments of the society, how do you get to treat them? Because at one point we understand that these treatments, they are extremely necessary, they might be life-saving in some cases, but at the same end we also understand the fact that there might be cases in which some of such people complain, healthcare providers, they subject them to some kind of a discrimination. So how then can we have that safe and ethical practice of treating such vulnerable segments of the Pakistani society?
Actually, when we talk of discrimination, it's basically an advanced issue. If we talk of basic care providing by a reconstructive surgeon, honestly speaking, at the periphery, at even district and division levels, we have very limited, very scarce facilities regarding reconstruction.
Right.
Like, plastic surgeons, of course, they are, in limited number, they are clustered in the bigger cities. At periphery, they are not available. And even if we extend the talk from Dr. Varda, very rightly said that the localities, they do matter. Like, of course, these facilities are not available at the periphery. Even if we talk of the weather, different weathers, they affect the disease differently. Like if I talk of my management of the burns, patients, their number increases to 4 to 10 times, tenfold increase in winters as compared to the summers. So the facility which was initially even adequate or sub-adequate, it is exposed because of the increased number of patients, and that becomes insufficient.
Right.
And they even, that affects the cost as well. Like at the periphery, there are smaller issues like the skin cancers, like trauma, they can be easily managed in a smaller way. But
so do we have enough surgeons? You see, this is again another very important question.
That is very important.
Because this is a very important concern for the entire healthcare system, that do we or do we not have enough and qualified enough and competent enough professionals so as to be able to the disease burden as it does exist in the Pakistani society?
That's right. If we talk of just basic areas, honestly, the reconstructive surgeons, they are far less as compared, they are needed.
Right,
but when we talk of the different surgeries and different areas of involvement, like if, God forbid, if you have remembered the Ahmedpur Sharkia event, there was initial immediate burn with many victims coming out all together. We are having scarce limited sources. And the same is with the trauma. And in the advanced world, the trauma is far more increasing, like motor vehicle trauma, like the building fall-offs. So there are many things. But unfortunately, we are having limited facilities for reconstruction at the periphery.
Right.
And these are, of course, very costly because they require multiple sessions, they make multiple, series of surgeries, and they are not. But as far as we were talking about the discrimination, which basically usually doesn't exist. I will quote an example.
So there have been studies where actually the trans community has come forward and been very explicit about this. They have come across doctors who have refused to treat them just because they've been a transgender. And similar is the case with people with different abilities too. And even if you see the discrimination is something which is not explicit, perhaps the hospital care is such, it in itself hampers that person's access, to the healthcare.
Basically, I have actually many examples to quote, but I will quote one due to limited time. Like when I was basically, I got my graduation and post-graduation from King Edward before going abroad, then coming back. I will talk of like two patients, they come up with the chest pain. Like one is having a pain due to stomach issue, other one is having pain due to the cardiac issue.
Right, sir.
The patient with the stomach issue is far more crying, his attendants are far more serious, far more aggressive, that the patient is serious. On the other stance, the patient with the chest pain due to heart is sunk down, is calmed, he's not crying. We rush and run towards the patient in the emergency because he is going due to heart pain. Patient is coming up with the heart attack right at the same moment, but he is having a life threat. On the contrast, the patient with the stomach issue having severe pain and he's crying, attendants, they think that we are discriminating. The patient is, is tossing in the bed, we are neglecting, and we are going to the patient who is mum and silent. They try not to understand. The patient who is mom having the same issue, probably presenting with the same pain, he is having life threat. And the person who is having more pain, he is tossing in the bed thou, but he is having no life risk.
Right, sir. On which I'll come to you, Dr. Sahiba, and here we must also talk about the most common myths, the most common misconceptions that you do come across in your work of a gynecologist, and these we understand also, for that matter, hinder one's access to the healthcare system. So as a distinguished gynecologist in your right, would you share some myths or, for that matter, misconceptions that you do come across?
I'm glad that you are coming up with this topic, because I really wanted to discuss a topic which is very important for women's health perspective. The most common being, I would like to quote an example first, which I have seen in my practical experience, which is about subfertility. So usually women come for their concerns regarding the fertility issues, and only the female partner is always investigated. So it's important, equally important, that the male partner should also be investigated, because usually most of the infertility cases, if they're 40% because of the women, 35% cases are because of the male partner.
Right.
So in case of subfertility, infertility is some common misconception that only female partner needs to be treated. They both need to be treated.
Right.
The other misconception being that breast cancer, which is one of the most common cancers currently in Pakistan. Whenever you visit some kind of cancer care institute, you will see almost more than 50% patients presenting with the symptoms of breast cancer.
Even in cases of cervical cancer and ovarian cancer, they have been on a very rampant rise too.
In the discussion of breast cancer specifically, there is a common misconception that only the elderly women who are crossing the 40 years of age, only they get breast cancers.
Although statistics, they suggest otherwise, because we do understand the fact that in Pakistan, women are not only prone to get a more aggressive form of breast cancer, but more women in their 30s and 40s over a period of time have been reported to actually fall victim to the disease.
But with regards to this, sometimes patients, they do come to us as a reconstructive, and they come up with the cancers in even 20 to 25 years of age. They are very early reported cases.
Right.
And it's totally unfortunate.
Right. But here, when we talk about this from the viewpoint of the society, we need to understand the fact that a lot of people might have these wrong conceptions or misconceptions about women's health, but they might not be very open, be voicing the same, which is why we need to address all these social taboos, which is why we need to address the social stigma. So how particularly do you feel can we do that when if the society at large doesn't feel that this is something very wrong?
I feel like for example, in the case of breast cancer, we are there is this month dedicated entirely to breast cancer.
Month of October.
Yes. So you know that October is the month of breast cancer awareness. So we only talk about the awareness, about the regular checkups, self-care, screening programs during that month. It should be done on monthly basis on national TV, on national print media, digital media.
No, PTV every year very dedicatedly
raises
I know
that.
issues, and I also know this, not otherwise, but you know, I've also done not one, rather several talk shows on this. But I feel then the responsibility is something which just doesn't lie on the electronic media. This is also something which then should transcend to other media, more particularly social media. On which, sir, I'll take your narrative. Now we understand the fact that mental health is also something around which we see there has been a lot of stigma. And in this regard, we also understand the fact the government in a first has also launched this app by the name of Hamraz, along with an integrated helpline, the purpose of which is to make mental health care services more accessible to the vulnerable parts of the Pakistani population. Whereas, of course, we appreciate the fact that this in itself is a very welcome move, but do you not feel then that the conversations around mental health and the stigma that we do attach around it, that is also something which needs to be reshaped at a very basic level?
Actually, I will second her, Dr. Varda, that there are so many taboos. You have to break those barriers. So same is true for the mental health issues as well. So you will see so many patients actually living a normal life, but actually they are having significant mental issues. So they need to be looked into that.
Right, sir. But in continuation to that, we must also talk about the need for there to be adequate and, of course, enough, psychotherapists and psychologists and psychiatrists in the country so as to be able to actually address all these mental health concerns. So, as a doctor in your own right, how do you feel can we cater this particular issue?
Actually, in trauma, there are so many examples in which the treatment goes beyond a certain time. And patients' mental health is affected. So one of such things is called post-traumatic stress disorder.
Right.
So what happens is that we sometimes have to involve the psychiatrist in the management of those.
Right. So basically in continuation to that too, then again we must talk about this growing concern of medical malpractice and medical negligence, as we do see it being reported in Pakistan, not now but for a very long time, and this we understand is also a growing concern in different quarters of the world. Now I understand the fact that you have been working with regards to medical legal reports, more particularly in the UK. So when you compare overall the medical doctors regulation, when you compare medical negligence as it is addressed in Pakistan to what it is addressed, abroad in different various jurisdictions, how do you draw that comparison?
Actually, the medical negligence system is different. So what happens is that in UK, if a complaint arises, that is dealt with initially at NHS or the hospital level.
Right.
And if it is not sorted, that's escalated to a further legal level. In Pakistan, they have a healthcare commission which deals with all those issues in a proper way. On other side, the patients, they are more likely to complain and raise legal issues in abroad. In Pakistan, you really have to do something wrong to be complained of. Patients sometimes they don't know their rights to complain, but however, now I've seen in the recent times that they do have
more awareness as
more
opposed
awareness.
to before, because we do see a lot of such cases being reported on media. Sir, would you agree with me on that?
Actually,
because generally the reporting mechanisms, they have become more effective too, and the reporting per se, that has also increased.
But if I talk of it, I would take in three categories.
Right, sir.
Like negligences are, one is true negligence, that there was something wrong happened in the care providing which should not have been. The second is basically the clinician has provided very good, adequate, enough care which should have been.
Right, sir.
But unfortunately, patient considered to be inadequate.
Right.
And the third category is that everything is all fine, but patient is also having just firm false belief that they have been not taken properly. Like if the negligence has been actually executed, like if it's of course wrong treatment or maltreatment has been, like if it comes with the like aesthetic surgery or cosmetic surgery, something was not due, overdone, right? Which was not desired has been done.
Right.
Sometimes patients come up with, like if go with the rhinoplasty patients, then a nose job has been done very nicely, but unfortunately patient is not happy. This actually comes up not with the surgical negligence. It is actually is wrong with the selection of the patients.
Right.
Like sometimes patient is having something wrong in his mind. He may be taking some anxiety medications.
Right,
So it's
sir.
a reconstruction.
Right.
So basically it's a different tier at which you're taking about the stance of the patient and how you providing the care.
Right, sir. So then in continuation to what you said, it's very important then to also consider the fact that when we do talk about ensuring that people have that adequate access to healthcare system in the country, more particularly when it comes to accessing mental health care, here it's equally important that they must have the right access and of course timely access to a psychiatrist, to psychologists. So as a doctor yourself, sir, would you agree with that?
Yes, I would give you an example from my orthopedic practice is that one thing is that the treatment is actually not short-lived. The patient's response on day one differs from the beginning to the end. For example, after a major joint replacement surgery, between week 3 and week 6, they don't get much benefit.
Right.
So whereas initially they are getting day-by-day response, and between week 3 and 6, the response is plateaued. So it is that time in which they get depression. So anyone who comes to see them, they will say, oh, XYZ is walking, why are you not walking? So that is the time when a patient, they start complaining, what I have achieved in getting this surgery. So it is that particular time that they need psychological support.
But sir, here then we must also of course talk about this growing issue of medical negligence and medical malpractice as it does exist in Pakistan and in other communities too. So in this regard, when it comes to tackling this very issue, which is a very important, because unless we actually do away with it, we can't improve the patient health outcomes or the quality of service provision in the healthcare system. How do you feel can we do just that?
Yeah, actually, negligence, they do happen, right, starting from a very minor negligence to the major. Even as a rescue surgeon, I have seen patients refer to me with the treatment provided was even worse than the original disease process. But we can minimize them like in many ways. Like first of all, we should train our doctors in that they should be having good expertise, they should develop their skills to deal with. And second is, we should also have the true patients, like we should select them while making the choice of any procedure, particularly in cosmetic surgery.
Right, sir.
Like I have seen patients, like if they come up with any problem and they ask about something change in their face, like nose, like lips and all, and ultimately you put your heart in to treat them, but at the end they are not satisfied most of the time. And they have some psychological disorder associated with that. That's not only the cosmetic appearance of the disease.
Of course.
And even I have got a few of my paper published abroad in even Pakistan regarding the anxiety related to the patient's pre and post plastic surgery.
Right, sir.
Because it is, sometimes I have seen patients, like if you relieve their facial issues or their issues of their appearance, they have their anxiety settle down.
Right.
And as far as the skills of the doctors are concerned, we have many bodies to monitor them, like starting from PMDC to the Healthcare Commission, even College of Physicians and Surgeons is having a look on it. Even every subject, every specialty has its own.
And healthcare commissions in different provinces.
In provinces, of course. And even every specialty has its own internal boards, like in plastic surgery, if we talk of, we have PAPS, Pakistan Association of Plastic Surgery. They have their, monetary values. They give membership to the specialized people. They assess them, they know them, and once they consider that they're up to the level, they give membership to the doctors, so that they should be up to the mark to minimize the negligence.
Right, sir. But do you not feel then here that community health is also something that we actively need to promote? Because a lot of times there might be people out there who might not have that optimum access to healthcare providers or even hospitals, especially people belonging to rural areas, but they might have access to midwives, they might have access to lady health workers. So in this regard, how significant is promotion of community health so as to promote and of course improve the quality and standard of healthcare provision in the country?
I read something somewhere that one of the most recession busting tip is sue your healthcare provider. So in my trauma practice, I've seen that anyone whose card is hit from behind, they never get better. So the people who are self-employed, have a mortgage to pay, have the bills to pay, they are more likely to improve rather than someone, if they know someone is to be blamed.
Right.
So in Dr. Afzal's practice, so they can easily blame, look, you have done this and we are not happy with this.
Right.
So in my practice, I've seen that, for example, I'll give you an example that we take bone grafts. So if you take a bone graft from Illy Crest, patients keep on complaining of pain because you have taken this. He came to us with a clavicle fracture and I've taken a graft from there. So they are never happy.
Basically, this is a concern which then applies with regards to different, medical concerns that anybody might have, and this is something which might apply in the cases that you do get to treat, because a lot of times we see that many issues related to women's health also impact their mental health adversely.
Exactly, Fatma. First of all, it is important to define what exactly is medical negligence, because in cases of gynae as well, there are a lot of cases which are being reported, but it is important to address a common thing that is happening in the labor room. As a resident, I have seen it during my residency, and as a consultant, I am also seeing that I would like to quote an example from my residency days, that me and my team was dealing with two emergency situations at one time. One was of hemorrhage and another was of chronic hypertension with the eclamptic fits, which are the fits, and it's a very serious condition. So at that point, another patient came. She had simple urinary tract infection, but she wanted to get evaluated right away.
Right.
So I asked her to wait, but she was not willing to wait. She was like, I will go to higher authorities and I will do this. So it's important to define what exactly is medical negligence, because it's very common in women health.
This can be a card which can be used against doctors too, and this is something that we do see happening not only in Pakistan, in fact world over too, on which I'll come to you, sir. And before we conclude today's show here, it's equally important then to also talk about the significance of community health in Pakistan. Now we do see that community health is that one area, is that of course one medical intervention which is seen as a means to improve one's access to healthcare system, that too in different parts of the world. For one, I would want to name Sri Lanka in this regard. So do you not feel then as a doctor that this is something which must equally apply in Pakistan too, because there are a lot of people out there, especially those belonging to the rural and remote villages in the country, who might not have that optimum access to healthcare provision. So in cases like these, community health is something which they could perhaps fall back on.
We have to see what we can do and what we can't. We keep on saying about our resources and awareness and education, but there are few things you can easily do. For example, when a child is born, every child should be assessed for, I'm speaking from my own specialty,
Right.
The child should be looked for congenital dislocation of hip joint. It's quite simple. That doesn't need infrastructure. It's just awareness, education. Even you can use social media platforms for that. I can tell you that if a child is diagnosed with a congenital dislocation of hip joint on day 1, the treatment is simple, double nappies. Whereas the same thing, if it is misdiagnosis, after 2 years, the treatment is entirely different. I feel so sorry that I have seen so many cases at year 4, 5.
So basically then what you mean to say is that the emphasis then needs to be on a preventive approach as opposed to having a merely curative one. On which, sir, I'll come to you. Here we must talk about this from a global perspective, and we understand the fact that globally there have been policies which have been emphasizing on the need for us to eradicate poverty. And in this regard, I would particularly want to quote the Millennium Development Goals 1, which very categorically talks about reduction of poverty and hunger. So when we talk about improving our policies, sir, what is it that Pakistan here then needs to do?
Right, as when we compare our health policies with the rest of the world, we need some, innovative areas which we have to consider too.
Right.
The first and foremost which I consider is we need to decentralize it. Decentralize means we have specialized care is basically clustered into the cities, the major cities, metropolis cities. We need to shift it to the district and division levels, even if possible to the tehsil levels.
Right, sir.
Because most of the time patients, they are traveling from far-flung areas to the major areas, and ultimately they are having, that shatters the resources present there because it's an imbalance from the referral. Even more important is there is no mechanism for proper referral. Because patients, like if we talk of, they are referred from a very far-flung area straight away to the bigger city.
Right.
Even that facility which they are seeking for may be available in their near district. So there must be a channel of referral, as we consider in US or UK. We have a general practitioner GP who is taking care of, and the concept of my doctor still exists.
Right.
He takes care of them. If he needs a specialized, he refers to, and the referral is always been quoted and documented.
Right.
One. And second is basically we need the facilities which are of course minimal as compared to our population. We should increase and enhance the resources of the health. We need more equipped facilities at the periphery. We need to have some incentives and some attractions for the doctors to work in the periphery, which we have already done so far, like they get extra marks for their specialization. But once they are specialized, they're becoming consultant. They must be having some equal attraction to work in. Either they should be benefited in their service or in their income or whatever. They should be having some attraction to work at the periphery.
Right, sir.
And the last but not the least is we should create awareness, because many diseases, they have their best outcome in prevention. If we talk of even the burns, if we go 100 and even thousands operations in any part of the modern world, we can't get anything to be absolutely normal as we initially managed with Harold Gillies.
That's very rightly put by yourself.
We need to prevent burns in any case.
Right.
So prevention and awareness is the first.
Prevention, of course, and mitigation by
That's
that
right.
yardstick too.
Exactly.
Because a lot of times we see when health emergencies, they also impact societies. The best thing that can then be done is, of course, to work towards prevention,
early diagnosis,
and mitigation. Exactly.
early presentation, and presentation at the proper time, so that the facilities, like if I'm working at the hospital with King Edward Medical University, we have referred from all corners of Pakistan.
Right.
Is it possible to cater Honestly not. Sometimes I have a long queue for waiting, like patient, they come up, they have waiting time for 3 years sometime, and we have to make policies rather than to manage them, we have to make policies for them how we have to cater their facilities.
Right. And in this regard, we understand that there needs to be a very integrated approach where
That's right.
all stakeholders are working together,
That must be.
on which I'll come to you, madam. And before we conclude today's show, here we must also talk about the very important role which we do see modern technology, which we do see social media playing, especially with regards to facilitating the average person's access to the healthcare system. So in this regard, what more can we expect for technology to do so as to bridge that gap between the healthcare system and an average person's access to it?
I agree, Fatma. As you know, as you already know, that social media is power. Everything is digitalized right now, and we all have witnessed the success of telemedicine departments during the COVID-19 times. So I think the more and more telemedicine departments should be established with more and more healthcare providers, not just the gynecologists, but also the primary healthcare physicians, midwives, lady health visitor. They should be able to tackle all those queries. Besides that, mobile applications are also being made currently. They are also being proven really beneficial for the women's health, because they are being able to track, and they are being able to come up with follow-up reports as well. Besides that, there are so many online education resources available, where there are some evidence-based studies being conducted and being available for 24/7 for patients' education. So they can be used as
and
well.
And we do have a lot of online sites now too, who actually connect patients with the kind of consultation that they do want, which is of course facilitated that access.
Exactly. We call it the virtual consultations, and also the e-webinars, where patients and doctors are directly communicating, and the question and answer sessions are being conducted.
So but here what's very important then, Dr. Sahiba, is all be mindful of the fact that the language which is being used in all these online platforms, that is respectful. That is something which doesn't per se trigger any kind of shame or stigma from, of course, the patient too. And that is something on which, sir, I think you also earlier very rightly so mentioned that when we talk about, of course, treating the patient, it must be done in a very respectful manner, because a lot of times we also see bad news, like news relating to cancer and other, serious diseases, that is actually given to the patient in a very perhaps inhumane or insensitive manner. So whereas the use of technology is something which can actually bridge that gap between the common man and the healthcare system, it should also be something which should be used in a productive, in a constructive and empathetic manner. On which note, I would like to conclude today's show. Thank you so much, Dr. Saab. Thank you so much, Dr. Afzal. Thank you so much, Dr. Wada, for being here with us today. Well, to conclude today's show, we generally spoke about the various challenges that Pakistan's healthcare system is faced with. In this regard, whereas, of course, it is very important for us to not only seriously work upon improving the quality of service provision, what is equally important for us is also to ensure the fact that an average Pakistani's access to the healthcare system, that in itself is something which is actively worked upon, that in itself is something which is then facilitated, because unless we do away with all these health inequalities, we can't possibly strive to overall improve both the quality as well as the standard of the healthcare system in the country. On that note, signing off for today. Until next time, take care and Allah Hafiz.